Now, good. Let us have another discussion about proton pump inhibitors. These are drugs which prevent your body from producing hydrochloric acid, which is a good component for H. pylori growth in the stomach, and again, which is also associated with the ulcers in our body. So that is our today's topic. Now, what is this proton pump inhibitors? These proton pump inhibitors, first of all, we have to understand what is proton pump. So what is a proton pump? In this proton pump, before you understand what is proton pump, we should be able to understand the three pathways in acid production in our body. And the three pathways are followed by the acetylcholine pathway, which is more of a central nervous system, autonomic nervous system. Then they have the gastrin pathway, and then we have the histamine pathway. The histamine pathway is about histamine 2 pathways. So those are the three ways our stomach produce acid in our stomach. And any management of gastric ulcers will at least focus on inhibition of these three methods of acid production in the body by the parietal cells in the gastrointestinal system, specifically the stomach. Now, you can see in this diagram is that you can see the parietal cells, and then you can see the three pathways of acid production. Now, what these proton pump inhibitors is, they are drugs that activate in acid environment. Means what? These drugs works in acidic media. So if you don't have acid in the stomach, these drugs will not work. And this is the reason why you have to take the feed 30 minutes, 1 hour before you are taking these drugs, so that you can stimulate production of acid in your stomach, so that the drugs will be able to work well. If you take these drugs with food, they won't work well. You want to achieve therapeutic targets of your interest. So after the absorption of these drugs, the metabolites diffused in the parietal cells and accumulates in the acid excretory canaliculi, where they block acid production. So the metabolites of these proton pump inhibitors is the one which works to prevent acid production. So examples of proton pump inhibitors, the most common one is highly abused in our setup is omeprazole. We have lansoprazole, we have esomeprazole, we have pantoprazole, and we have lansoprazole. Currently, also they have the fifth proton pump inhibitors, which is called elaprazole, which is called elaprazole, the only one molecule in the fifth generation. So let us see the mechanism of action of these drugs. So we have seen that in our body, we produce acid through three pathways. There is the acetylcholine pathway, there is the histamine pathway, and also the gastrin pathway. Those are the three ways we produce our acid in the body. So let us look first of all on this one called the histamine pathways. And specifically, we are talking about the histamine 2 pathway. You remember the histamine 1 pathway is associated with things like inflammation, like eosinophils, basophils are the one which produce this one. Is a molecule of inflammation process, and it is inhibited by drugs like antihistamine and also things like celestamine or histamine. So in this case, now we are talking about histamine 2. So histamine 2, it is produced, then this one histamine 2 enters the parietal cell, and through the pathway of CAP-dependent pathways, where it influences the androgen proton pump at peace. Then in the positive way, then the androgen molecule, the histamine in CAMP-dependent pathways activates androgen potassium at peace, where there is release of androgen in the androgen in the GIT. The release of androgen in the GIT, increasing production of hydrochloric acid, and then the androgen plus the choline from the parietal cells, they go to the stomach and now they make hydrochloric acid, and this one hydrochloric acid then is harmful. So there is this drug we call histamine brokers. They work at that point, and this is another topic for another day. So another pathway is that acetylcholine pathways, which is muscarinic antagonist drugs, where they work at M3, the muscarinic effect of these drugs. That is where they work, which works in the pathways of calcium pathways dependent. Now you can see that acetylcholine works in the calcium dependent pathways, where the gastrin activates the production of this acid. The other pathway is through that way, and then they combine. They work through the same pathways with the acetylcholine, and you can see where there is the blockage of the acetylcholine by muscarinic receptors to prevent acid. On the other side, you can see where the histamine 2 receptors antagonists are blocked when those drugs work, and then you can see where the CCK receptors, which blocks the gastric production by the gastrin, where they work, where they stop the gastrin from activating the calcium-dependent pathways for the production of acid. Now, then you can see now the proton pump inhibitors. The good thing with the proton pump inhibitors is that at the central point where these three pathways of acid production are, where the hydrogen potassium pump is at plus 8p production of 8p energy. Now, this is where they work, because at this point that the potassium, the release of hydrogen, then it is taken back into the parietal cells so that it can increase the production of hydrochloric acid. So this is where it works. This is where this one works. So the consumption of food stimulates hydrochloric acid, and excretion activates acid, and acid excretion activates proton pump inhibitors. So our body requires acid for the purpose of these drugs to work, and that is how they work at this point of hydrogen potassium at peace blockage. So the activated proton pump is converted into sulfonamide in the acid excretory canaliculi of the parietal cells, and this sulfonamide interacts covalently with the sulfonyl group in the proton pump and makes it complex, thereby reversibly inhibiting the production of acid. That is the mode of action of that drug. So you can see various photos there about example of a brand where this now you have taken omeprazole, it is in your brand. Then this omeprazole enters into your parietal cell canaliculi, lumen of the parietal cell, lumen where it is converted into sulfonamide intermediate. And at this point now you can see that in the brand there is hydrogen plus this molecule. Then there is 3 steps. Then you can see this hydrogen, potassium, and ATPase interchange, where the enzyme inhibits the complex of this production of this acid in this molecule. So let us look at pharmacokinetics of these drugs. So these drugs, the rate of clearance of proton pump inhibitors is absorbed is increased if you take concurrently with food. And this is a very serious thing, because so many patients are never advised on the relationship between these type of drugs and what? And the relationship between the food and the way they have to take food. So ideally, the patient to take the food for 30 minutes to 2 hours before taking the drug, for the drug to work well. So that and when you take like that, the effect can persist even to 3 days. Since an acid pH in the parietal cells acid chemical is required for drug to activation, so you have to advise these people to take food at 30 minutes prior. So in a chronic renal failure, the drug does not accumulate, which that means this drug is very safe in kidney failure, and again in liver failure. Substantially reduces the clearance of esomeprazole and esomeprazole. So when a patient is having a renal failure, because this is where the drugs are metabolized by the using the system, the pathway of the 450 P enzyme. So the people can do what? They can get with liver failure. They can get what we call proton pump drugs toxicity. So what are the side effects of this drug is that they are short-term effects like some common like nausea, diarrhea, abdominal pain, fatigue, and dizziness. Then because of the use of this gastric acid, there is interference of vitamin B12. You know that vitamin B12 is an intrinsic type of vitamin, meaning that the body makes it. It is only 2 vitamins, that is B12, vitamin K are the only vitamins the body makes in itself. We call them intrinsic types of vitamin. And in this case now, the absorption of these B12 by patients who are taking long-term use of PPI may lead to deficiency of vitamin B12. So when a patient is taking B12, when a patient is taking PPI for too long, it is very wise for you to do a supplementation with vitamin B12. Now, in the long-term effect of this drug is that in the specific but not common of the use of proton pump long-term treatment for management of GERD, because this drug is used to treatment GERD. Now, there are so many common problems because it may cause dependency by increasing gastric symptoms if they are discontinued. So it can create dependency, meaning that the patient will continue buying the drugs on themselves over the counter, and long-term problem can occur. So, however, thoracic proton pump therapy has no impact on calcium, vitamin D, or bone metabolism in a healthy young men. So, if you take a vitamin proton pump for at least 3 months, then it cannot have any issue on bones. Then long-term therapy also interferes with the zinc absorption and the zinc body. And then that means it can interfere with things. And you know that zinc is very important in epithelial cells integrity, which epithelial cells are part of the first defense mechanism in immunology. Again, zinc is very important for maintaining for fertility. Now, these type of drugs called proton pump inhibitors, we use them in treatment of dyspepsia, peptic ulcer disease, gastroesophageal reflux diseases. Of course, you combine them with other diseases when you're using a GERD, then pharyngeal reflux, stress, gastritis prevention, and also Zollinger syndromes, often very regular doses required compared to other medications. Therapeutics, use again is that proton pump inhibitors are used primarily to promote healing of the gastric ulcers and duodenal ulcers to treat and also to treat gastroesophageal reflux. So lansoprazole is one of the drugs approved by FDA for treatment and the prevention of non-steroidal anti-inflammatory drugs and gastric ulcer associated type of drug. Non-steroidal anti-inflammatory drugs is examples like brufen, diclofenac, because people overtake this drug over the counter. Then, in children, omeprazole is safe and effective for treatment of erosive esophagitis, and young patients generally have an increased metabolic capacity, which may explain the need for higher doses of omeprazole per kg body weight in children compared to 100. Meaning that you know that the treatment of a drug is that in general perception is that the management of various cases is that we give drugs in terms of kg body weight. That is, the more the body weight to increase the dose. But in this case, this is a drug which behaves in a very different way that you see that in children, they have high metabolic rates, yet that means that these people will require excess drug, unless old people who have low metabolic activities, meaning that they will be there, the dose will be low. So in this case, that the raised type of drug or omeprazole is that the older the people becomes, the more you reduce the dose, like the other way around, where the older people are given higher doses. So let's get some questions about ourselves. So let us see the drug interaction in comparison with other drugs. Like you see that, like pantoprazole bioavailability is 77%. The available, and then the maximum is 5.73, which is for 40 milligrams, and 0.7 for 20 milligrams in 5 minutes. So you can see it's a good drug. Then duration of effect is 24 to 72 hours for omeprazole. Then binding is 98. It binds the protein, means that these drugs circulate all by the body. It does not have any side effect. But omeprazole, the drug interactions, then you can see that omeprazole bioavailability is started 40%. Then maximum is 0.70 to 20 milligrams, and the effect is 24 to 72 hours with protein binding of 95. That means it is very well available in the body, to circulate all over the body. But this omeprazole, as you have to be very careful when you're giving this drug, because it interacts with diazepam or warfarin. Diazepam is a drug used for the purpose of like mental issues, so you have to be very careful when you give this drug. Another drug you have to be very careful is things drug like warfarin, which is a thinner brand venous, the injection for the drugs which are used for the heart conditions, heart failure. Then patients who are using a phenytoin, which is also for drugs for epilepsies, you have to be very careful when you're giving omeprazole. Antifungal like ketoconazole, you have to be very careful when you're giving this type of drugs. Then lansoprazole drug is the bioavailability 77 to 80%. Then with that, when you give that milligrams, because it comes in the milligrams of that milligrams, the maximum is around 25. Is around 25. Is around 25. Is around 25. Then ketoconazole, the offering and the ketoconazole is one of the drugs. Is one of the drugs which causes the drug interactions. So when you're giving somebody lansoprazole, you have to be very careful because of the offering, for example, patients who have asthma. And you have to remember very well that there is a relationship between the gastric acid and asthma. And in this case, you may be attempted to do what? To treat with the offering. So we have omeprazole, which is the bioavailability is 52, 52, and the maximum is 48 when you give milligrams, 48, you give 20 milligrams of 20 milligrams, and it acts within 24. Protein binding capacity is 96. That means the drug can circulate too much in the body. And then omeprazole is 64 with a maximum of 1.8, which the drug comes in a milligrams of 20 milligrams, and the duration of effect is 24 to 72. And the protein binding is 97, and it does not have in drug interaction. So that is the difference of the player we get there. This information from. Thank you very much for hosting this discussion about the proton pump inhibitors. The key thing is that always remember to give this drug 30 minutes before taking meal if you want to get a good result. Remember, these drugs are used in management of so many cases like GERD, in the Zoriga health syndromes, and also management of non-steroidal anti-inflammatory gastritis, all those things. So it's a very good drug, and we have to make use of this drug because they work at proton pump where androgen and potassium at the piece. That is where these drugs work. Thank you very much for listening to this lecture. Have a pleasant evening.